Ever wondered if over-the-counter medications are always safe because they don't need a prescription? Let's dive into this common misconception. Over-the-counter, or OTC medications, are a convenient solution for minor aches, pains, and other common ailments. They're right there on the shelf at your local pharmacy, no doctor's note required. But this accessibility can sometimes lead to the mistaken belief that these drugs are always safe and risk-free. Let's be clear. OTC medications, like all drugs, carry potential risks. Misuse, whether by taking too much, too often, or in combination with certain other drugs, can lead to serious health complications. Just because you can buy them without a prescription doesn't mean they're harmless. Think about it this way. Even something as commonplace as aspirin, an OTC drug that's been around for well over a century, can cause stomach bleeding if taken in large doses. And that's not even touching on how it can interact with other medications. Or let's consider cough medicine. It's a staple in many households for battling colds and flus. Yet, did you know that some cough medicines contain ingredients that, if misused, can lead to liver damage or even affect your heart rhythm? Moreover, just because an OTC drug is approved for use by adults doesn't mean it's safe for children or the elderly. Each individual's health status, age, and other medications they are taking can significantly affect how their body responds to an OTC medication. So here's the bottom line. OTC medications are designed to be safe for the general population when used correctly. But correctly is the key word here. It's essential to read and follow the instructions on the label, be aware of potential interactions with other drugs, and understand that even OTC medications can have side effects. So remember, over-the-counter doesn't always equate to harmless. It's important to approach these medications with the same caution and respect as you would any other medical treatment. Stay tuned for more insights on unlocking the secrets of over-the-counter medications in our next segment. Now that we've debunked some misconceptions, let's delve into the different types of over-the-counter or OTC medications. First up are analgesics. These are medications that help to alleviate pain. They come in many forms, including tablets, creams, and patches, and are the go-to choice for dealing with anything from a headache to a sprained ankle. Next, we have cold and cough medicines. These are designed to help soothe the symptoms of a cold or cough, such as a runny nose or a sore throat. Some of these medications can also help to reduce a fever or suppress a cough, making you feel more comfortable as your body fights off the infection. Then there are antacids. These are medications that work by neutralizing stomach acid. They're commonly used to provide quick relief from heartburn or indigestion. Antacids come in several forms, including chewable tablets, liquids, and capsules. Allergy medications come next. These are designed to help manage the symptoms of allergies, such as sneezing, itching, and watery eyes. They work by blocking the action of histamine, a substance in the body that triggers allergic reactions. Last but not least, we have laxatives. These are medications that help to promote bowel movements. They come in a variety of forms, including tablets, liquids, and suppositories, and are typically used to treat constipation. Now, it's important to remember that while OTC medications are available without a prescription, they're not without risks. They can interact with other medications you're taking, and they can have side effects, especially if taken in large amounts or for a long period of time. Always read the label and follow the instructions, and if in doubt, consult a healthcare professional. Knowing the types of OTC medications can help you make informed decisions about what to use. Understanding what you're taking and why is crucial. So, what are the uses and potential risks of these over-the-counter medications? Over-the-counter or OTC medications can be a godsend when you're battling a headache, fighting off a cold, or dealing with a sudden allergy attack. They come in different forms and types, each designed to address a specific ailment or condition. For instance, pain relievers like acetaminophen or ibuprofen help alleviate discomfort from headaches, muscle aches, and fevers. Antihistamines, on the other hand, are your go-to remedy for allergies, while decongestants can help clear a stuffy nose. Antacids can neutralize stomach acid and provide relief from heartburn. But while these medications can provide quick relief, they are not without potential risks. One of the most common is the risk of side effects. For instance, some pain relievers might cause stomach upset or increase your risk of liver damage when taken in large amounts. Decongestants can lead to increased heart rate and blood pressure, and antihistamines can cause drowsiness or dizziness. Allergic reactions are another risk. While they are rare, they can be severe and in some cases life-threatening. Reactions can range from hives and rash to difficulty breathing and swelling of the face or throat. Lastly, there's the risk of interactions with other drugs. Many OTC medications can interact with prescription drugs, dietary supplements, and even certain foods and beverages, potentially leading to serious health issues. For example, taking a decongestant if you're on high blood pressure medication can cause your blood pressure to spike. It's important to remember that just because a medication is available without a prescription, it doesn't mean it's harmless. Always read the label, follow the instructions, and consult with a healthcare professional if you're unsure. Remember, while OTC medications can help with a range of health issues, they also carry potential risks. How can we use these medications safely and avoid dangerous interactions? This is a question we've all asked ourselves at one point or another. Let's dive into the answer. When it comes to over-the-counter medications, they may seem harmless because they're so readily available, but they're still drugs and should be used with caution. The first step to safe use is following dosage instructions to a T. This isn't an area where more means better. Doubling up on a dose won't make you recover twice as fast. In fact, it could lead to an overdose, causing more harm than good. Next, it's crucial to be aware of the active ingredients in your medications. Many over-the-counter drugs contain the same active ingredient. For example, you might not realize that your cold medicine and your pain reliever both contain acetaminophen. Taking them together could result in exceeding the recommended daily dosage, which can be harmful to your liver. Also, consider the possible interactions with other substances. This includes prescription medications, other over-the-counter drugs, and even food or drinks. For instance, some medications can cause drowsiness and should not be taken with alcohol. Others might interact with certain foods, affecting how the body absorbs the medication. And remember, just because a medication is available without a prescription doesn't mean it's safe for everyone. People with certain health conditions, pregnant or breastfeeding women, and those taking certain prescription medications should always consult a healthcare professional before taking any new over-the-counter medication. So how can you ensure you're using these medications safely? Here's a quick recap. Follow the dosage instructions, know the active ingredients, consider possible interactions, and when in doubt, ask a healthcare professional. It's also worth mentioning that the internet is a vast resource of information, but it shouldn't replace professional medical advice. While it can be helpful for general knowledge, your healthcare provider knows your health history and can provide personalized advice. Stay safe by always reading the label and consulting with a healthcare professional if you're unsure. Knowledge is power when it comes to over-the-counter medications. Being informed and vigilant can help you avoid dangerous interactions and ensure safe use. Let's recap what we've learned about over-the-counter medications. Today, we've journeyed through the world of these readily accessible drugs, starting with debunking common misconceptions. We've clarified that just because a medication is available over the counter doesn't mean it's harmless. The incorrect use of these medicines can lead to serious health complications. We also busted the myth that OTC medications don't interact with other drugs. In fact, they can and often do interact, sometimes with severe consequences. From there, we navigated the wide array of OTC medications available in the market. We grouped them into three broad categories: analgesics for pain relief, antihistamines for allergies, and decongestants for cold and flu symptoms. We also highlighted the importance of reading labels to know what active ingredients are in these medications. Next, we delved deeper into the uses and potential risks of these medications. We emphasized that while OTC drugs can alleviate a variety of symptoms, they don't cure the underlying disease. We also discussed potential side effects and the risk of dependence, especially with prolonged use of certain types of these medications, such as nasal decongestants and sleep aids. We then moved to the crucial topic of safe use and interactions. We underscored that understanding your medication, knowing its purpose, and following the recommended dosage is vital. We also highlighted the importance of consideration for any potential interactions with other drugs you may be taking. In conclusion, even though OTC medications are easily accessible and widely used, they should not be taken lightly. They can be extremely beneficial when used correctly, but can also pose serious risks if misused or misunderstood. Therefore, it's crucial to educate yourself about these medications, their correct use, potential interactions, and risks. Remember, Not every symptom needs medication, and sometimes the best medicine is a good rest and plenty of fluids. Arming yourself with knowledge is the first step to safe and effective use of over-the-counter medications. Thank you for watching, and remember to like and subscribe the video.